Welcome my friends to my channel. I'm Bob Schrupp, physical therapist, providing you with physical therapy treatments that you can do within the confines of your own home, which is pretty cool. Today we're going to talk about bicep pain. Are you having pain right in your bicep? Now this is especially for those of you who do some weightlifting, and while you're weightlifting, you're doing your curls and you can start to feel some pain. Generally it's right in the belly, what we call the belly of the bicep. Now one of the simple treatments you can do for this is what we call cross fiber friction massage. It's a mouthful, but all it is a very deep massage you're going to do using a couple of fingers. You can usually do one finger right on top of the other, or two fingers right together, or three fingers together, and you're going to go right over the area that's tender. Now, generally, if it is the bicep, it is going to hurt when you do curls or when you turn your wrist this way and go do curls, because that really isolates the bicep. So what you're going to want to do, get a pillow, and I want you to lay your arm on the pillow like this. You're going to expose the area, of course, and you're going to find, I want the bicep relaxed, so that's why you're going to have the arm bent and the palm up. So you're going to find the tender spot. If you cannot find a tender spot, maybe the pain is not coming from your bicep, maybe instead it's coming from the shoulder or your neck. They can refer pain down into the bicep and make it feel like that's the problem, when actually the real problem is up in the neck or shoulder. Okay, so if you are able to find the tender spot, what you're going to want to do is you're going to rub across. Now this is not just moving the skin here, you're getting down deep into the tissue and rubbing across like this. Now if you start rubbing, you find the tender spot and you start rubbing, and it's just getting worse and worse and worse as you rub, then it may be too tender to even do this, maybe even too tender to start this. You may have to put some ice on it or some heat or something and get it to calm down. Probably ice would probably be the better idea to start off with. What ideally you should feel is that as you start rubbing here and you find the tender spot on the bicep, is that after a minute or two it actually starts to feel a little bit decreased and maybe even a little bit numb. Again, I'm not just moving the skin here, I'm going deep into the tissue. It may not look like I'm pushing hard, but I am pushing very hard. And what we're doing here is breaking up scar tissue and helping it realign. The problem here quite often is, and that's why bicep pain or tricep pain can keep going on for a long time, especially if you're a weightlifter. You're like, geez, I've been letting this heal, and I come back to it and it just starts hurting again, is that scar tissue starts to form, and then as soon as you start doing the exercise again, the scar tissue breaks open. So what we want to do is help it heal in a strong manner, so that when you do lift again, and you should start to lift on light weights once the pain is gone, light weights and work up to heavy weights, is that the scar tissue will be able to hold and not break open anymore. Again, you can do this, I would go ahead, you can do this for a long time. You can work up to, I'd go ahead and do it up for 3 to 5 minutes every other day, and do it until the pain is gone. And I'm going to be also talking about bicep tendonitis in my next video, and that's pain more up in the shoulder. So please subscribe below. Thanks a lot for watching.